Well, time now is 9:17, and Children's Hospital is just weeks away from opening a brand new behavioral health center for children and teens. Hear how it'll feed a big unmet need in the area. All right, thank you to Condra. Well, just a couple of weeks, Children's Hospital cuts the ribbon on its brand new expanded behavioral health center, and they say this will be a game changer for parents looking for a facility that can provide care for children and adolescents. The goal is to teach and empower these young patients to develop healthy life skills. We're joined by Chief Medical Officer Dr. George Bissett and Ben Whitworth, the Vice President of Hospital Operations. Good morning. How y'all doing?
Good morning.
So how is this going to address the critical needs in the area? Tell me about what you're trying to accomplish with this.
Well, we think that the opening of this behavioral health center is going to be a centerpiece for behavioral care throughout the state and the Gulf South region. This is going to be an opportunity for any child with behavioral health, mental disorders to come for their care.
It's something that we've been talking about in the community. It seems like for years, more opportunities, more outreach for folks that are dealing with these issues, and now it seems like something is actually happening. Ben, what sort of things will this facility have for those kids?
Absolutely. So this is an expansion of the facility. From an inpatient perspective, we'll be able to have, we're going from 39 to 51 inpatient beds, which is around 500 more children per year that we can see on the inpatient side. And from an offerings perspective, this space will allow us to better offer expressive therapy. So each child receives 3 to 4 of those per day. So whether it's art or yoga, music, outdoor recreation, this space will really allow us to enhance those offerings.
And George, I guess how does that help mold, especially a mind that is growing and still learning?
Well, we know that if you can reach children before the age of 14, when you start to see these mental disorders, these behavioral health problems surface, if you get them earlier, you can deal with them more effectively and you can have better treatment outcomes.
This is all about really attacking the underlying issue that might bubble up and cause so many more issues that we tend to spend a lot of money on trying to fix, right?
Exactly. And when you look at the behavioral health issues in the country today, it's difficult to think that 1 out of 6 teenagers over the last year has considered suicide. It's an amazingly complex problem, but it's pervasive.
And as a parent, you know, sometimes it's hard to think about your child having some sort of an actual behavioral problem. What would you tell parents who might think there may be something? Now there's, you know, more opportunity for you to get help. I mean, how do you talk with parents about that?
Yeah, I think a lot of it is just seeking the appropriate help. Most of that help initially comes through the school. But certainly we're going to be there as the safety net for those children that need care, whether it be on an outpatient basis. We're going to have extensive outpatient facilities to be able to deal with autism spectrum disorders, to deal with ADHD, mood disorders, just about anything you could encounter in the behavioral health, mental illness category. And we're going to be ready on the inpatient side. We're going to have the largest facility when it opens, one of the largest independent facilities in the country.
Yeah, been a large investment, but something that you hope is going to pay off tenfold.
Yeah, absolutely. Sure. It's around a $25 million investment just in this facility, opening later this winter. It's part of a broader $300 million investment into the Children's Hospital campus. And so we're thrilled to be a part of providing care for children, not only in New Orleans, but throughout Louisiana and the entire region.
Excellent. Thank you so much for all your work. We appreciate it. Look forward to see how that all works out.
Thank you very much.
Take care, fellas.